this section, we will train you on how to use the HoverMatt air transfer system as an effective tool to prone patients in the operating room onto a spinal table. We will explain how to set up the equipment and patient for proning, and the technique for proning the patient onto the operating table. We will show you how using the HoverMatt to prone a patient significantly reduces the manual force needed to position a patient onto a spinal table. The patient begins on a stretcher with a HoverMatt beneath his or her body with all side rails raised. The stretcher should be positioned close to the table with enough room to allow the caregivers to have access to both sides of the patient. Lock the stretcher wheels. Have the patient move toward the spinal table so that they are off-center on the stretcher. If the patient is not able to assist, inflate the HoverMatt and slide the patient to the desired location. Disconnect the safety straps. Tuck the HoverMatt about 4 inches under the patient on the side closest to the table. Tuck the safety straps under the mat, one towards the shoulder and the other towards the feet. Wrap a pillowcase around the patient's arm closest to the spinal table and tuck both ends snugly under the patient. This will secure the arm in place so that it does not get caught between the stretcher and table as the patient is being transferred. Lower the side rail closest to the operating table. Unlock the wheels, move the stretcher against the spinal table, and lock the wheels. The height of the stretcher should be slightly higher than that of the spinal table. The safety strap should not be attached while prone positioning. Note that if using a Jackson spinal table, the stretcher should be at the same height or slightly higher than the hip pads. A minimum of 4 caregivers are needed for this patient handling task. 1 caregiver turns the patient, 1 receives the patient, 1 guides the patient's head, and the 4th caregiver guides the patient's legs and feet. For larger patients, 2 caregivers should be positioned on the receiving side. Position the air supply cart alongside the stretcher by the person who will turn the patient. If no cart is used, place the air supply on the stretcher on the side of the person turning the patient. Ensure that all tubes and lines, if any, are clear of patient contact, kinking, or disconnection during and after the turn. Employ the headrest pillow as per the manufacturer's recommendation prior to turning the patient. If the patient is conscious, explain the task, then the caregiver on the patient's side will advise the foot-end caregiver to turn on the air supply. The caregiver on the patient's side will pull up gently as the HoverMatt inflates. This will facilitate the turning of the patient on the edge of the stretcher. With larger patients, this caregiver may need to gently push to keep the momentum. As the patient begins to roll onto his or her side at the edge of the stretcher, the caregiver on the receiving side is positioned against the OR table, with both hands raised to receive the patient's body at the shoulder and hip. At the same time, the 3rd caregiver guides the patient's legs and feet, and the 4th caregiver guides the head onto the headrest pillow. The patient is then lowered onto the OR table in the prone position. Once the patient is centered, have the foot-end caregiver turn off the air supply. After surgery, bring the stretcher back alongside the spinal table. Ensure that the wheels of the stretcher and table are locked. Return the patient onto the stretcher as per your current hospital protocol. Key points from this section. The HoverMatt air transfer system is an effective tool to prone patients onto a spinal table. Using the HoverMatt to prone patients significantly reduces the manual force required to position the patient, thus reducing the potential for staff injury. Please refer to the HoverMatt user manual for complete instructions.